Welcome to this lesson on understanding the mental health gap in low and middle income countries, also known as LMIC.
Around the world today, millions of people live with mental, neurological, and substance use disorders. But in many low and middle income countries, including Nigeria, most of these people never receive the care they need. This difference between those who need mental health care and those who actually receive it is what we call the mental health gap. Let's take a closer look at what that gap really means and why it matters. In LMIC, up to 75 to 90% of people with mental health conditions receive no treatment at all. Think about that for a moment. That means that for every 10 people living with depression, anxiety, or psychosis, only 1 or 2 may ever get support. The rest are left to suffer in silence. But it's not because they don't want help. It's because help is often unavailable, unaffordable, or unacceptable in their context. Let's pause for a moment and reflect. Have you ever seen someone in your community who clearly needed help but had nowhere to go? What would it mean for them and their family if support was easy to access? Now, what causes this gap? There are several factors. First, there's a shortage of trained mental health professionals.
In some LMIC, there may be only one psychiatrist per million people, if any at all. This means most people simply don't have access to specialist care. Second, there's stigma and misunderstanding. Many people believe mental illness is a sign of spiritual weakness, a curse, or personal failure. This discourages individuals and families from seeking help early. Third, there's limited funding and infrastructure. Mental health often receives less than 2% of national health budgets, and most of that goes to large psychiatric hospitals in major cities. Meanwhile, rural and underserved areas are left behind.
Finally, even where services exist, they may not be culturally appropriate or close to home. People may not trust or relate to the care they're offered.
But here's the good news. This gap can be closed. And it doesn't start with big hospitals or expensive equipment. It starts in communities, with people like you. The World Health Organization's Mental Health Gap Action Program, or MHGAP, was created to help non-specialists, including community health workers, teachers, faith leaders, and caregivers, recognize and respond to common mental health conditions.
This means that even if you're not a psychiatrist or psychologist, you can still provide meaningful support to people in your community. You can offer empathy, you can recognize early warning signs, and you can connect people to care, whether through local clinics, peer support, or even simple listening and encouragement. In summary, the mental health gap in LMICs is large, but not impossible to close. It's caused by a lack of trained professionals, persistent stigma, limited funding, and inaccessible services. But with the right tools, training, and commitment, we can bring care to the people who need it most. In the next lesson, we'll explore how non-specialists, like you, are uniquely positioned to make a difference in mental health care delivery. Because when care is brought closer to the community, healing becomes possible for everyone. Let's continue.